It's a pleasure to have you with us, Professor Davidovic. If you can just tell us a little bit about yourself and where you come from.
First of all, thank you so much for your very kind invitation. I'm a vascular surgeon from Serbia. I'm the head of the Clinic for Vascular and Vascular Surgery of the Serbian Clinical Center, as well as I have one of the very important functions in the European Society for Cardiovascular Surgery. Since 2008, I am advisor, and since 2010, I'm counselor, as well as member of the executive committee of that society, and finally president of the Vascular Scientific Program Committee.
I see, and so next year we're looking forward to ESCVS in France. What is the particular attraction of bringing this conference to France?
I think there are some very important reasons. The first one, France is one of the most important European countries with really a large number of vascular surgeons. Some of them at the moment are really leading European vascular surgeons. Then France was cradle of vascular surgery. I would like to remind you, aortic surgery started more than 50 years ago, and famous professor René Leriche first described aorta-iliac occlusive disease. Fontaine described classification at symptoms of patients with peripheral occlusive disease. Then famous Jean Coulin performed first femoropopliteal bypass reconstruction. Jacques Coudot and Charles Dibot performed first procedures on the abdominal aorta more than 50 years ago. Finally, more than 60 years ago, European Society for Cardiovascular Surgery has been founded in Strasbourg, in France. The first president of that society was René Leriche. Because of all previous reasons, I believe that the organization of our Congress in France is extremely important.
So it's kind of coming full circle, bringing it back to France and bringing the conference to Nice.
If we would like to organize a good Congress, we should have two main ideas. The first idea is attractive location of the Congress, and as you know, Nice is one of the most popular and known location over the world. Then, the most important reason, Nice has a very good connection with many European countries. Finally, we should organize good scientific program, and our idea is to invite really leading European vascular surgeons. Some of them at the moment are from France.
Mm-hmm. Great. And so you've been a member of the executive committee since 2008. How have you seen the ESCVS develop in that time?
European Society for Vascular Surgery, or Cardiovascular and Vascular Surgery, has been organized, founded more than 60 years ago. I already explained you. That society has a very important and long tradition. That is the oldest society which gathers cardiac and vascular surgeons, not only in Europe, over the world. Many other important vascular, cardiac and other cardiovascular societies have been founded many years after that. Because of that, our society has special relation with all of them. And I believe that at the moment our society is one of the leading organization which gathers cardiac, vascular and cardiovascular surgeons in the world.
Great, thanks very much.
Thank you. It is.